Okay, good afternoon, guys. This is NPR. We have two guests right now. It's one patient, Ada Loparno from Venezuela, and the Dr. Thu from United States.
Hello, guys.
Okay. I have some question for you guys. Is medical tourism good or bad, and why?
Okay. In my opinion, a couple weeks, I have passion I need to travel for India for a surgery. I need to transplant for the hair. So I think it's very good because I feeling better than before. So for my experience, it's very good. So I think that is very opportunity for travel in other countries.
In your opinion?
Yeah, in my opinion, I think it's not good at all because when someone really sick, they can go to overseas to find a hospital for a good treatment. Because they really sick, they can go far away. And the other thing, they don't have enough money to go overseas for treatment, so they need to go the hospital really. And in their country, I think they will have some benefit for the poor people. So I think the medical tourism is not good at all.
So you're saying medical tourism is not cheap?
Yeah, I think it's not cheap because when you go overseas, you have to buy a ticket for airplane. But when you can go alone, you have to go with someone relationship to take care of you because you're sick. So that cost a lot of money. And then when you done the surgery, you have to stay at the hospital for 2 weeks to come back to check up. If everything good, you can go home. But something everything's have problem, you have to stay more than your plan. So that cost a lot of money.
What do you think about
In my opinion, I agree with the doctor because I traveled a couple weeks, so it's not cheap. And it's cheap because you need pay first for the surgery and then for the ability or recuperation. So you need to stay in the country for months, or I don't know what you need for the surgery. So it's not cheap. In my experience, it's not cheap. But it's good for the surgery and the good doctors and something. These things.
Okay. How safe do you think is medical tourism?
It's very safe because the doctor have track records and good luxuries, the hotels, and very natural, and it's good. I think this is very good for this.
Okay. And what do you think about that?
I think it's not safe because you don't know what will happen when you feel good and you come back home. So I don't know what happened in your way to come back home. So that far away, and then if it happened in the way come back home, what should you do at that time? And then in some country they not safe at all. They have a lot of chaos. So like Thailand. So I think it's not safe. I'm afraid that.
Okay, the security is not good in the country.
Yeah, I saw it in the news. It's a lot of chaos.
Okay, so okay. Okay. for you, what kind of credentials the doctor need to have so you can trust them?
Well, it's very important this thing because the doctor need to have good records, that you need to found that experience for the doctors, or you need, first I think that you need to find the hospital and then to think for the records for the doctors.
Okay. And for you, it's doctors in the United States better than the international doctors from India?
I think it depends on doctor because in the other country they can go to the United States to study for doctor, but that not mean in the doctor in United States good at all. So it depends on doctor, depend on their experience.
I see. Okay. Another question, the last question. What are the effects of having an international hospital near your house? Or
In my opinion, if my house near the hospital, I think it's not safe at all because at least in the hospital have the patient they have many sick, and I don't think the air not good at all.
contagious?
Yeah, the virus.
Viruses. And what about you?
Okay, in my opinion, the effect is very complete because there's in this country you need to travel and very difficult for many people in this. So this is my opinion.
Okay. And that's it for this.
You guys?
This broadcast.
It's broadcast.
Thank you.